The latest advice from the National Incident Centre just prior to coming to the COAG meeting is that has now grown to 49 countries around the world, so an additional 7 countries in the last 24 hours. That confirms the decision that the National Security Committee took after the very important work of the state, territory and Commonwealth Chief Health and Medical Officers in providing advice to the Commonwealth on the risk of pandemic. We have determined that likelihood has been reached, and therefore that's why we have activated the Commonwealth coronavirus pandemic plan. My judgment coming out of the meeting with the states and territories today is that we were better prepared. They were more advanced than I had previously known. Since our discussions on Sunday as a collective with the states and territories, they've taken even greater strides.
As Mr Hunt said, we are in a state of preparedness in Australia. We have accepted the very strong likelihood that we will get further cases and some further transmission of this virus in Australia, given the international situation with several countries having sustained community transmission. As we know, and we've said on many occasions, the great majority of people infected with this virus have a very, very mild disease. More than 80% of people have a mild disease. Our concern, of course, is preparing for any patients who have the more severe disease that need hospital treatment and respiratory and other support. I do want to reiterate, though, that at this stage we are still contained in Australia. We do not have any evidence whatsoever of community transmission in this country. So whilst we are preparing and we are realistic about what might come in future weeks, we are not in a situation where anyone needs to be concerned. No one should go around wearing and wasting face masks, please.
Is the greatest risk likely to be in aged care?
Within Australia, we have identified, because of the nature of the coronavirus around the world, that the elderly are the most vulnerable. That's clinically well established. I think the last figures that I saw is that the median age for loss of life was about 71 and a half. And that means those that are elderly, and in particular those that have difficulties with immune system, are most at risk, and that's why that's our absolute top priority.
In terms of what's being stockpiled by way of resources and whatnot, is there enough masks and hand gels, sanitisation? Does Australia have enough, and is there any issue with getting those supplies in? And also, if those supplies are activated, how will people access them? Is it through their GP pharmacy?
Sure. So firstly, we are well stocked. The National Medical Stockpile includes approximately 20 million masks, and we've already provided some through the bushfire crisis and some through what are called the primary health networks. One of the things we did focus on was making sure that we do have strong supply chains. That's part of our job. That was one of the items that is a specific Commonwealth action item, and so we'll continue to go forward, and we're well prepared, and as the Chief Medical Officer has said, even though it seems like a very basic point, soap and water are as good a hand hygiene as anything else. Brendan?
Preparations, have you looked today at plans for schools, like if you have to
I'll let Jenny talk
close
about
them down?
At this point in time, there's certainly no need for us to be envisaging doing that, but of course we need to look at what the risks might be. I should point out that, and of course Professor Brendan Murphy can add to this as well, that the risk to children has been a very low one. We've not had children who've been severely impacted by this. It's tended to be elderly people who've been most ill. But of course we need to respond to the situation as it arises. Just wanted to make one further comment, if I could, around the supply chain, because we had questions about that before, and the need for us to be nimble and respond to the evolving situation. Of course, a lot of our supply chain, our supplies are actually from overseas. As demand grows internationally, and perhaps some supplies in China might be impacted by their own local manufacturing having been shut down. We need to be innovative. We need to be nimble. So Greg and I have been having discussions around local manufacturers here in Victoria that might be able to scale up their production. We might